Hello, I am Luisa Cabal, UNAIDS Regional Director for Latin America and the Caribbean, and today I join you to commemorate World AIDS Day. This year's theme, Take the Rights Path, highlights a powerful message. We can end AIDS if we protect everyone's rights. The progress we have made in the response to HIV in our region is directly linked to advances in human rights. When human rights are at the center and governments protect them, and communities lead the way, we can prevent new infections and reduce AIDS-related deaths. But we still have a lot of work to do. Gaps in human rights stand in the way. Many people are still left out of health and other services and continue to suffer from stigma and discrimination. What do the data tell us in our region? We see in Latin America a 9% increase in new HIV infections, and thankfully, a 22% decrease of new infections in the Caribbean. But in our region as a whole, we share a common challenge. Key populations and populations in positions of vulnerability, such as migrants, indigenous, Afro-descendant communities, youth, and women, continue to face significant barriers, violence and discrimination that fuel new HIV infections and impede access to services. Despite the challenges, it is encouraging to see significant shift towards decriminalization of same-sex relations in Caribbean countries, changes in legislation and policy to include migrants in HIV services in Peru, government actions to make the recommended treatment regimen accessible to people in Colombia, efforts to strengthen the response in the territories in Argentina, actions to leverage resources for HIV in Guatemala through the issuance of bonds, and Brazil's leadership in the G20 presidency with the creation of the Global Coalition for the Local and Regional Production of Medicines. Undoubtedly, these are signs of leadership. But we still have a great number of challenges. Many regulations prevent services from being truly people-centered. We need people to be able to access self-testing, PrEP, in communities which are closer to the people, to provide prevention and treatment services in support of the government's role as guarantor of the right to health. We must eliminate these barriers and replace them with mechanisms that guarantee health. In the face of discriminatory practices, we must invest more so that each person who provides a service does it with dignity and without stigmatizing anyone, so that we're all part of the solution within the health system, in the education and the labor sectors, and in the public forces. Ending AIDS goes beyond medical treatment or drugs. It is about ensuring that all people, no matter who they are, have equal access to health and the realization of their rights. A legal environment that respects and protects human rights is essential to providing effective and equitable HIV services. This World AIDS Day, let us renew our commitment to a future where AIDS is no longer a public health threat. Together, by protecting rights, we can protect the health of everyone, and we can end AIDS by 2030. To the governments, communities, and allied partners in this joint effort, thank you for your leadership and dedication in this fight.